The risks and protective factors of using drugs. Week 2. This lesson focuses on the different risks and protective factors in substance use, abuse, and drug dependence. Things that contribute to drug abuse are known as risk factors, while protective factors prevent drug use. In this lesson, you will be asked to discuss in depth these risk factors and protective factors and analyze the different situations where you might encounter these specific examples. Risk and protective factors for drug use, misuse, abuse, and dependence. The use, misuse, and abuse of drugs are the result of various factors surrounding a person. Protective factors, on the other hand, are those influences which decrease the chances of using, misusing, and abusing drugs. Domains of life which affect drug use and abuse. Personal, early aggressive behavior versus self-control. Risk factor. Use of drugs at an early age. Risk-taking behavior. Experimentation. Poor social skills and interaction. Childhood problems. Feelings of isolation. Protective factors. Self-control behavior. Good reasoning skills. Excellent social skills. Positive interaction with people. Sense of belonging. Family, weak parental guidance versus strong parental guidance. Risk factor. History and patterns of drug use. Attitudes toward drug use. Poor parenting and child rearing. Inconsistent family rules. Poor family values. Poor family ties. Protective factors. Good communication with people. Positive family relationship. Clear and consistent family rules. Strong family values. Positive expectation to child success in family, school, and community. Peers and friends, substance abuse versus academic excellence. Risk factors. Association with peers and friends known to use gateway drugs, cigarettes, and alcohol. Preference to stay with peers and friends than with family. Protective factors. Association with peers and friends who do not use gateway drugs. Formation of friendships. Reliance on friends for emotional support. Inviting friends at home to know the family. School, availability of drugs versus strong anti-drug policies. Risk factors. Poor academic performance. Lack of commitment to studies. Poor attendance in school. Involvement in fights and conflicts. Protective factors. Good to excellent academic performance. Participation to extracurricular activities and school organizations. Interest in attending classes. Community, poverty versus strong community relationship. Risk factors. Easy access to gateway drugs. Poor community organization and neighborhood relationship. Poor implementation of community laws. Negative attitudes which favor drug use. Protective factors. Strong community relationships. Active and positive community programs, projects and activities for the youth. Positive attitude which combat drug use, strong community advocacy against drugs. Thank you. See you next week.